The public health crisis of suicide in our armed forces, in our veteran population, and in our communities has not waned in the face of COVID-19. We must still remain vigilant and innovative in the ways that we address mental health and suicide in our communities. My hope is that we will have an opportunity to come back together in person to continue the work that we started with our Resilience Tactical Pause and to do more of those kinds of activities as a unit going forward. For now, I'd like to remind us of two important models and principles in suicide prevention. The first, and which is one I hope is familiar to everybody, is the ACE model. And the ACE is an acronym that stands for Ask, Care, and Escort. A is ask. If you are talking to someone or you know of someone who is in distress, ask the question, have you had thoughts of killing yourself? Ask the question directly and don't use evasive language. Have you had thoughts of killing yourself? Have you thought about going to sleep and not waking up? Ask the question. The C stands for care, and that means show care to the person that you're talking to your wingman. If they hesitate or they're not clear about the answers to your questions, ask follow-up questions. Express how much you care about them and the empathy that you feel for their situation. And then finally, the E stands for escort. And that means if your wingman is expressing suicidal thoughts, then escort them to a professional who can help them. This environment, escorting might look very differently than it has before, but utilize the Suicide Prevention Lifeline, call myself, call a chaplain, conference call, get online with your wingman. Make sure your NCO, make sure that you're getting your wingman, your friend, your family member, whoever it is that you're working with, get them to professional help. Counseling centers are open. They're using telehealth. Shelters are open. If someone doesn't feel safe in their home, there may still be some place for them to go. So please, escort, don't leave your loved one alone. Don't leave your wingman alone. If you can't be with them physically, make sure that you're connecting with them and you're connecting them with the help that they need.